Hi, my name is Dr. Anthony Ngatia. Today I'm taking over. I'm the new host of the One Health podcast, Journey to UHC. I've kicked out all the hosts, and today I'll be interviewing the famous Dr. Diana, and I've kicked out Dr. Kigondo. Please stay tuned. This is a recap for season 1. Over.
Hello, welcome to the One Health Lands podcast. I'm your host, Dr. Diana Wangari Gitao. Today we're having a slightly different show because it's been a whole season, right? Can you believe it? We've had different guests, different conversations around universal health coverage, public health, global health, innovation, artificial intelligence, cancer. We've covered quite a bit in season 1. And so today we have this special episode as a recap, going behind the scenes, so to speak, a conversation with a good friend around what have we learned, what could we do better, what's the future like. And so, my good friend.
My name is Dr. Anthony Ngatia. And today I am doing a coup d'etat. I am the one who's taking over the host seats, yes. Our senior Kigondo is not here, so even him is being kicked out. So today I'm the host, you're on the hot seat.
Yes.
And we'll ask you a few questions. So this question you've asked so many times, today I will ask you, tell me a little bit more about yourself.
How did I end up here?
How did you end up here? All that good story.
The good stuff.
The good stuff.
It's always interesting because most people who meet me say, wait, you're a doctor or are you a journalist, right? And I always say it's possible to be more than one thing, right? You can't be a doctor and you can't be a journalist at the same time, right? And for me, journalism came by chance, really, right? I was in medical school, in many ways, trying to raise money, right? For school fees, side hustle, most people, right? And while it began as a journey to make money, right, I also came to realize the more you got exposed, this is at Kenyatta National Hospital, you'd see a lot of patients who are coming with advanced disease, right? And so then a lot of it being preventable, how you'd get to see how information had a huge role to play, right? The same way we say screening for cancer, right? Yeah. If you knew that you need to maybe do some tests, or maybe you need to feel certain things, there are certain changes you need to observe, right? That information, how it plays a critical role in healthcare, right? And in many ways, I found myself thinking that I don't have to do medicine and see patients to make an impact, right? There are different ways in which we can practice medicine that is not necessarily clinical. So as I was finishing medical school, I was thinking, okay, fine. The pathway doesn't have to be clinical. I could go into public health communication, right? I could go into media, right? Media is not just news, right? Communication is not always just about sensational, right? It does have a role in public good, right? So then I was firmly set on a path that was more journalism, communication, and advocacy, really, right? Saying if I combine the medicine I know, which means I can communicate with people in the public health and medical field easily, I can understand the jargon, but at the same time I have training and experience that then I'm able to simplify this in a way that the person on the other end can understand, right? And this could be a way to make a difference. And so I've been around the block. I've worked in local international media. I've done Radio Africa. I've done, Standard Group Nation media, as you can see. So, that's me.
Okay, wait. So in medical school, there's no class called communication. Maybe is probably
communication
a subset
101.
in
Public health,
community health. It's a small unit.
Yeah.
How did you think this is the route for you? Who's your inspiration, or were you just doing this all in the dark? Like, this is the route I want to take.
I think you start off in the dark, then you get mentors. And in many ways, we always underestimate the role of mentorship. And people always say mentorship is you must get the senior person well established. But for me, it was that I found lecturers. I found, people in the medical association or profession already who are thinking outside the box, right? I mean, Simon Kigondu, we speak of him. He's been my co-host, right?
Yes.
It started way back, almost 14, 15 years ago, right? I can think of lectures. I could name quite a few. Tom Olewa, I could mention Dr. Ngatia. I could mention quite a few people who were saying, okay, fine, we're willing to support you as you're trying to figure it out. So you'd find them giving me guests, getting people who I could interview, you know. And sometimes you need that. It's not, you have to have the idea that I want to do something outside this, whatever it is, right? And then along the way, you find people who can guide you. Yeah.
Amazing. I mean, that's amazing. I mean, but I also know you have a MBA. So what is business again? So clearly you've had many side hustles. So what about those other side hustles? What's an MBA? Oxford, I don't know, side business school, all these big names.
Big names.
Yes.
Ivy League education.
Yes.
It's important.
Yeah.
I mean, you make fun, yet you've been to Oxford as well. You studied in Oxford University as well.
Do you know there's a front door that you enter in?
Yes.
There's a back door I entered through. So I cannot proclaim my back door entrance as the same way. But yes, please. What are the other things that you've dabbled in? Because I don't know, is it an entrepreneurial spirit in yourself that says, okay, I'm charting this path?
Yeah.
Or is it like seeing, okay, these guys have done it? Or is it just a drive of, I think I can make a big difference here? Like maybe even for your listeners and young people in general, how do you suggest and navigate these confusing times? Because things are changing and you clearly have embraced change. How do you actually do that?
One, a big shout out to our alumni, us as alumni of Oxford University.
Yes.
I mean, first, yes, I did go there to do a master's in business administration. And really, I think, one, it was after years of experience doing entrepreneurship in healthcare, right? I did go to start a chain of clinics that ended up going into South Sudan. We ended up working in technology, building mobile apps, EMR systems, programs in maternal child health. I mean, those were good, I think, 5 years or so in there, right? Yes. And they always say sometimes you stumble into these things, but the consistency is a key thing, right? I think starting off from that point where I always realized that I want to do more, it was never defined what more was, right? And I think the one guiding path was always that if I identify a need, I always felt an itch to do something about it, right? I already had a North Star, which was healthcare. Right. I already knew that this has been done before. I didn't necessarily know who has done it, like one-on-one, right? Or someone who was accessible, but I knew it could be done. And I suppose it's also personality, where I always imagine that if someone has done it, even if it was difficult, right? It has been done, right? Why can't you do it as well, right? Amazing. You can find, yes, of course, we had challenges. There are times when we were doing our clinics, there are times we were letting go of people. We didn't have money, you know. There are times you go months you haven't been paid or you haven't been able to pay yourself because it's your business as well, right? You went through the ups and downs of learning as you go along, right? Yes. You might not have the operational business acumen that's required, and you failed a lot. I think you failed more, right? But then the big thing there, and what has always been what I find to be the driver, you have to have an internal drive, right? To be consistent, right? To continue pushing, to continue, when you fall, you get up, right? And I think it's, you hear it in talks. I mean, Obama refers to it, Barack Obama, right? The ability to follow through, right? You can have an idea, but being able to execute it is another thing, right? And being able to say, despite despite the hardships, despite the obstacles, if someone has done it, why can't I do it, right?
Amazing.
And so, that led me to Oxford, led us to Oxford for the MBA, because, again, there's always the imposter element of you want a qualification, you want a stamp, right? You want to be able to say, with all the experience I have, maybe there's some knowledge I also need to add on. But why Oxford, I think, as well, was their connection to Africa, right? Their program, their MBA program was fantastic in terms of the networks you build back in Africa, back in Kenya, back at home. So,
Wow, amazing. Not a journalist, not a business person, not a doctor. I mean, I'm feeling embarrassed.
A pathfinder. Now. Call me a pathfinder.
Pathfinder. Okay, so let's now get to the podcast. Season 1 is over.
Yes.
Why this? Why are podcasts? Why this topic? Just overall, like, what's the general thinking here?
Yes, background, I started off by writing, right?
Yes.
Writing was easier, and mostly because you could do it remotely. You didn't have to, and this was pre-COVID, so then there was this idea that you must come in if you're doing a TV show, you're doing all these things, right? So I started by writing, But then there's certain things where sometimes you need to have a conversation and you need to bring life, right? So there was always an idea that as I'm writing, maybe I might want to introduce new elements. But more importantly, I think it's how the landscape as well was changing, right? Not many people are reading anymore. I mean, media across the world can attest to this, right? That where you get your audience nowadays might be, yes, in reading, but it's something short, right? It's not many people are buying newspapers, right? Not many people are tuning into TV shows as well. But more people are listening or watching short clips, right?
Yes.
So the medium was much clearer. And again, mentors. We have producers here who are keen to say, we'll support you, right? Kevin, James Smart, Joe Agero, who in many ways also, ventured me into this media landscape as well, or supported me, right? Back in the day as well. But yes, why podcasts? But I think what was more interesting was what to talk about, right? Because if you look up podcasts, you'll get quite a few podcasts out there, right? And what I found interesting, I think late last year, was Kenya had just launched universal health coverage, these 4 bills, right? And for a moment there, people were not clear what it is, right? What's first universal health coverage? Is it free care? Is it, what does it mean, right? And I thought to myself, alongside, again, very good mentors, right? Very good, I think, support system. That as we're embarking on this journey as a country, what can I do? What can we do? How can we take a seat at the table to say, can we educate Kenyans so that some of the questions that healthcare practitioners, policymakers have or get, right, we can be part of that journey, explain to people what universal health coverage is. And as we started it, it's sort of one step led to another, because it became, actually, the need is more than just universal health coverage. You need to break it down, right? And 1 season later, we've, covered quite a few things.
Amazing. That's actually very interesting. And I'm very surprised, because I always imagine doctors being boring. However, I think you've been able to get the best out of most of them. So that's good stuff. In 19 guests in. I know I'm your favorite so far. Of
course, naturally. You see how I introduce you as my good friend, not even guest.
Very good. But, I mean, very interesting guests. How do you choose them? As in... What's the process? What's the thinking? As in, other than me, who basically am awesome and I've taken over the show. And
you have said, I am coming.
And I'm coming by force. How do you actually choose guests? As in, and what's the motivation? What's your insight? What are you trying to pick out?
First and foremost, it's always been expertise, right? You want to bring subject matter experts, right? And I know it sounds like it's an obvious thing, but you always find sometimes there's what people say are experts, and it's by name only. But in many ways, you want someone who has walked the shoes, right? Who's been down that road. And when you use that as the final lens, you tend to find that then you distill to fewer and fewer experts, so to speak, right? So then it's expert who actually has, walked that journey, right? And then second, I think it's also what is relevant to common man, right?
Yeah.
Common man in this case being either the Kenyan citizen, the community health or public health community, right? And this, I think, is part of the learning even in the course of season 1, right? There was, first we needed to start off by breaking down some terms, some big policy items and whatnot, right? And then you get to realize that there are also some other burning issues, right? And so you go where the audience sometimes leads you. You don't deviate necessarily from the lens, and that's where even One Health lens came in. What lens will we use? You don't deviate from that, right? The key being you want experts in the room. You want to be able to discuss a topic that will have an impact to you and me, whether it's today or in future, right? But more importantly, you want to be able to say that at the end of that show, right, did I have a material impact? And sometimes it's not necessarily how many people clicked, but I could go into different episodes, but did you necessarily talk about a topic that will be important to a group, right? It's not just you sat and you said it's important to me, right? Yes, yeah.
Amazing. So, I know I'm your favorite. So, but I mean, like
shall
maybe
label you the favorite is back.
But maybe just like from the 18, 19 guests, like tell me a story, like as in what stands out, like tell me about one of the guests to explain that whole concept of it's important to the public, to you, like which guest actually personifies it. An example, I know all of them are amazing, not as good as me, but who personifies like an example of that, what you're trying to show as motivation.
In fact, I should be asking you this question first. Why don't you tell me what?
So me, I'm a fan. So let's start. I'm a fan. But I think one, the most, they're all interesting. But two stand out. So Dr. Super, for example, is a very interesting story.
Yes.
Still working in the counties, and as a medic, I've worked in Embu, worked in Kilifi, like. And as you specialize, there's a bigger pull to come back to Nairobi or just Nairobi environs. Staying in the mashinani is very hard. And also doing it in a difficult field like pediatric neurology.
I
like
know.
It's even tougher. Like how many EEGs are there in the counties? As in, what are all these tests? So here's a doctor who's just practicing with their clinical skills in the hardest of situations. And actually it's inspiring. Like as in it's... Okay, these are the ones who didn't quit. These are the ones who didn't quit.
Who didn't go to...
Yes, I think that's like a powerful story, that you've actually highlighted. Maybe the other one would actually be Dr. Wangari also. And I think that must have been like the first episode.
It was that day. And already that our shows are unscripted, right? Yeah. We might have a debrief, but it's for a larger part was unscripted. Not even a larger part, it is unscripted.
Yes.
And I remember Wangari, first of all, both of us were nervous, right?
Okay.
And, the producer is saying, Wangari, just come down, you'll be okay. And we're both asking, which Wangari? Such things, and us having this back and forth around what we thought was the conversation around universal health care.
Yeah.
And it's been more a personal conversation just amongst friends, right?
Yes.
About our experiences from where we started to now, right? And I like that element. And I think from that, it also guided how the rest of sort of the season built up, right? Whereas opposed to where we had what we thought was a program for the next few weeks. We said maybe we should take this unscripted approach and see where it goes, right? And the conversations become more authentic, right? Yeah.
But I think it's true. It did come out as authentic.
Yes.
And I'm surprised you guys weren't even during the show Wangari.
Which one?
Like, which one?
I tell you. I mean, another person who stands out, or a few other. We had the conversation with Honorable Nikal, right?
Yeah. Yes.
And that's a conversation where I was learning.
Yes.
I was listening. I'm even taking notes, not even for the show to ask questions, but taking notes, because the wealth of experience he has, right?
Yes.
The foresight he has, right? And you think to yourself, if I had, I will bring him on every other day, right? Almost to learn from him, right? That was one. I think about the private sector conversation, non-state actors we had with team theory, right?
Yes.
It's another one where, again, you find yourself learning more than anything else. You're thinking the private sector, the role it plays in Kenya's healthcare system is so enormous, right? I'm thinking about the conversation with Ruth Wamai, right?
Yes.
When both of them had come actually from the Kenya Obstetric Gynecology Society conference, their annual conference, and they were talking about carbetocin, right? The heat stable carbetocin. And they were talking about how it's a game changer. And typically you expect all these big terms about, it reduces maternal mortality from X to Y, whatever it is. And then Kigundu tells this story around the cleaners, right? The cleaners in Makueni County Hospital who go ahead and say, you know why this is a transformational, why this is a game changer? It's kausha. Then you're like, what do you mean kausha? It dries. What do you mean it dries? It's like, we're no longer mopping the same amount of blood we used to mop, right?
Wow.
You listen to that sad stories and you think, okay,
it's doing its work, but it's actually the effect on everything else. Like
absolutely, and you won't get that story necessarily covered in, say, as front page, right? It wouldn't be. It will be, yes, there's a new drug, but those stories come when you're having a conversation, right?
That's very cool. Now let's get into you. I think you started touching on it. What have we learned so far? Like, as in, it's season 1, there are many topics that you've covered. I mean, what are the takes, actually, just on Dr. Nikal?
Yes.
The fact that he said that it was the Kenya's presentation in WHO in 2004 that got this whole UHC agenda starting.
Absolutely.
I'm like, who would have known that?
No one.
And we're never even credited for it.
No.
Interesting.
It is. And if you think about it, how in many ways we have been victimized as, say, healthcare professionals, whether you're working in medical development space, in terms of we take a very one-sided approach, right? And it's always a conversation around we're eager to adapt practices from foreign, whether it's countries, bodies, and that's a different conversation altogether. But when you hear something like that UHC as a concept originated from Kenya, right? And you think, we have so much going on in this country. Why aren't we telling the stories? Why aren't we having this conversation?
We're telling the stories now.
We are.
Yes. So, topics. What have we learned? UHC.
What have we learned? I think, one, I want to start by, I think there's patience. And I know maybe this, when you started off, I would often be heard saying it sounds like it's a runaway train, right? That we as a country, and I say we because it is our country, right? We've launched universal health coverage, but there's a certain patience, there's a certain grace we need to give both the policy makers, decision makers, be it government, be it partners. There's a certain grace we need to give the implementers as well, the health workers, right? Suppliers who'll come in, right? Even us as patients, at one point, there's a certain grace. It's not all going to happen in one day, that everything is going to be fixed, right? I started learning that in many ways, a lot of things is a first step has been taken, right? And sometimes you need to shed the light on where the gaps are so that it's addressed. But don't expect that everything will be perfect in one go, right? And I think from a policy perspective, that's a lesson that came off. But maybe you have some technical lessons from your end.
No, I mean, to be honest, I think part of the discussions that you had are so amazing. Like, first, the breakdown of what the different components are. The whole discussion by Dennis on, okay, so what does this 2.7 actually mean? Is there a cap? Isn't there a cap? How should you actually think about it? What is KMA trying to do? I think the discussions have been so rich. But even just, I don't think we can do it enough justice. You just have to go and listen to the show. Dr. Nyekal gave a great overview of NHIF, the background, all the way into how we are here. And I think, as you was just saying, grace is important. But even at the end of the day, we're all Kenyans. We all want this to succeed. And I think that was actually echoed in one of your shows. That, I mean, we're all on the same journey. Like, as in, I want my mom to benefit from this. I want to benefit from this. I want my grandkids to benefit from this whole improved healthcare. So even as we have these discussions, you're so right. Grace is definitely needed. And I think it's something that's very interesting that's been picked up from all this. So, but yes, it's still a journey. We are still atujafika. Yes.
I mean, I always say that it's, as you're saying, it's a journey, it's a learning process. There's also been feedback we've been getting from listeners, right? One feedback that resonated was always that ensure when the guests are speaking, you ask them, how does it impact the Kenyan man, right?
Yes.
I mean, you were here talking about artificial intelligence, and towards the end I had to ask you, right,
Yes.
after all this, how does it impact, right? And I remember it was even one episode where we had this, it wasn't heated, it was more me talking with Kigondo, Dr. Kigondo, and saying, you know, the concerns of the Kenyan citizen is, if I get sick, do I get the care? Do I get the care without undergoing financial hardship? Meaning then I don't have to sell off items, I don't have to sell assets, I don't have to call people to fundraise, you know, which is the essence of universal health coverage, right? It is the fact that doctors will be there available, whether it's a senior doctor versus it is a nurse, but they have quality training so that there's quality care, right? There are even some, and this is how even we ended up having this conversation around breastfeeding. Right, it was feedback from listeners who are saying, you know what, beyond you talking about these technical elements, right, you could come here and talk about breastfeeding from morning to evening, right? There's so many elements, right? But there's someone who said, hey, but there's a struggle behind all this that we never talked about, you know? That kind of feedback, and I encourage it, that, you know what, we're not too hard to find. If you went on LinkedIn, you went on Facebook, you went on, actually, do people use Facebook?
Don't throw shade in a glass house.
I don't know, you went on X, all this, Instagram, wherever it is, right? We're not too hard to find. You can always look up and, you know, DM, right? Wherever it is, we're happy to have that conversation, because the privilege we have, and it's acknowledging its privilege, by speaking to you, you're able maybe to get me the head of X, right? I might know someone, you might know someone, right? We might be able to break it down to tiny pieces that are more digestible, right?
From the source, straight from the source. Yeah, that makes sense. Well, let's move on. I mean, and I understand it's the biggest part of this show, which is UHC, and I think we've done a great job in season 1. Maybe what else? What are the other interesting things we've done on the show other than UHC?
We've had conversations on innovation, right? We had the conversation around the breastfeeding startup, Maziwa, right? And their pump, which is very portable, that in many ways what she described was they have clients who are construction workers, right? Which eventually I think ended up being the title of the podcast, right? That it's that portable, just to bring it to a point where it's understandable, right? We've had conversation, and I think I want to have more
on that topic. So please let me understand.
Yeah.
Did she actually mean that this lady was still painting and doing her job
No.
with the pump on, or that she could be up and about?
She could be up and about with the pump.
Okay.
She could be up and about. She could be, you could carry it with you to work. And then no matter how strenuous your work is, you could just, you're not worrying about a lactation room and whatnot. That was the essence.
Okay.
Because a lot of people, when they think about lactation support, you always find it gravitates towards we must have a lactation room, we must put a fridge. And that in many ways was also trying to message that the support is not just a lactation room.
Yes.
Even if you're an employer, it goes beyond that. There's more beyond, the support, right? There's that. Another interesting, and this came towards tail end of season 1, there's been a lot of questions on medical matters as well. Right. We've had people talk about, they want to hear about cancers, which is just on the rise.
Yes.
So towards the end, we had a few more conversation on cancer. We've had requests, which is coming up on season 2. Amma, that's a different question about what comes in season 2.
That comes later. However, please, also, the surgery, and I'm disappointed we did not get names, because I've been seeing some guys who have lost weight and they say, I'm swimming, I'm doing what? We need those names. We need those names. We need the names.
Dr. Moyabi needs to come.
Yes, you need to tell us the names. Like, as in the guys were looking too good all around here. And yes.
You know what was interesting about that? The episode on weight loss was the fact that he was keen to highlight, and it actually just came out that weight loss surgery, be it whatever shape you take, right? Because there are multiple options, that there is a non-cosmetic need, right? Because people always imagine that the only reason why you're going to undergo weight loss surgery is because you want to look a certain way for certain very cosmetic and superficial reasons, right? This is why it's not covered by insurance and whatnot, right? And most people are not open to talk about it. But we know of people who are overweight that their knees become a problem. And eventually those people, in fact, what they require is knee surgery, right? Which already is surgery on its own. Yet you might find the option might be that, yes, if they cannot lose weight naturally, either diet, exercise and whatnot, weight loss surgery is the option. We know, he gave examples of diabetes, because the way our lives and our health are connected to our weight and nutrition is so central that weight loss is no longer just a cosmetic thing, right? It's a health thing, right? So that was amazing. Fertility. He had multiple examples. In fact, I think that was a second longest episode, if I'm not wrong.
No, but it was good. And in fact, even the nutritionist and even the whole process of how he does his assessments, I found it very interesting.
Yes.
But he still needs to give us names. So next time when you're having this conversation, if he comes back, get the names.
Dr.
Get the names.
Yes.
Okay.
Yeah.
One more on policy.
Yeah.
Okay, so UHC is one aspect.
Yes.
There's also been interesting discussions around policy.
Yeah.
I liked the KEMSA discussion.
Yes.
The many things around other aspects, and each different discussion has a policy angle. Like for neurology, what it would be.
Yeah.
In Kabetosin, is it policy different? So maybe let me ask this as a question, as opposed to what are the... Do you think policy makers actually take this advice? And that's one. Second, I'm a listener to the show. I am not in this health field. How does this help me?
Well, from a policy perspective, you're right that we did have many conversations, which always went back to a policy conversation. And I think in many ways, again, becomes one of the lens of the shows. I'll note this down. But that you want it not only just to impact you as the patient, you as the citizen, but it also translates to decision makers, right? I think something that was interesting across, be it the conversation around, we had the Rural Private Hospital Association.
Yes.
In the studio, right? And at that point, he was talking about the fact that they are no longer accepting NHIF card, which is what you'd imagine in rural areas where most people cannot afford to pay private insurance would use, right? But he talked about his journey, right? And why they even set up the association. And you get to realize that in many ways, we do have some very good minds in Kenya. We do have some very good policies. So even the policy makers, we have them already. Now, the translation between policy making to decision making, there seems to be a gap, right? And you could almost pick out in some of the conversations. Say, for example, when we had Super, as you mentioned, right? And she's talking about her being a pediatric neurologist, right, in the county. Working with patients in cerebral palsy, patients who, when you look at their drug load, just the cost first of investigation before we even get to treatment. And she talked about community initiatives and support programs she had to put in place, because she might work within the system, but there's only so much. She even has policy, they have policy documents, right? But they might not necessarily always be in a position where they're able to influence decision. Right? And there's competing priorities as well. So she talked about communities taking a role, right? Giving community voices, community-based initiatives, right? And you get to realize that part of that gap, in many ways, as in Kenya, we make fun of Serikali's idea. We've always sung that, how can the government help? There's a big role for community-based initiatives. There's a big role for just even advocacy in itself, right? Sometimes things, and I think Tim is the one who said this, Tim theory, when we're talking about non-state actors, the mind can only conceive what it has perceived, right? Something like this, right? You only know what you know, right? So education as well. When you talk about policy, I think Kenya has fantastic policy. They start dropping the policy and acts we have in place. You're like, wow, we had this. But the translation, and sometimes maybe education is not just on the community side, it's also on the decision maker side. Sometimes maybe we're too technical, even as healthcare professionals, policy professionals, that we have good documents, yet fundamentally the documents might be 20, 100, whatever number of pages. But then if you sit down with a decision maker who's looking at competing priorities, the conversation might be bottom line conversations, right? How does what you're discussing here affect my campaign? How does this, with the little I have, translate into multiplication for the economy, right? And at a certain point, I got a sense of, we in the profession, wherever space, we have not been good at communicating the needs, right? So it's very easy for us to say that we require an anesthesiologist. We all know we require a doctor. We all know. But how you present it as, we need a doctor because it's going to help in this, that will help your people, who will then be able to work and add to this, right? Or who will be able to vote for you. It's how you shape that conversation so that what people are hearing is not, we need this. It's a demand from these doctors who have studied too much, who use big words. That should not be the conversation. In fact, it should not come out. It should come to bottom line. How does it impact? And if you get better at communicating the needs, that I think would be further, even in terms of decision making, right? Because fundamentally, it goes back to money, finances, economy, right?
Processes. Actually, I think even to Dr. Lishenga's interview, understanding why your NHIF card is not being absorbed as a policy decision is a fact. Like, it's not that they woke up one day, it's that the policy is saying this, and this is the reality of the situation. And putting those two links, even to me, as a listener, I get a lot of insight. And granted, I'm in health. If as a raya, if I'm not in health, understanding that because at the end of the day, these decisions are actually ultimately also being controlled by people you vote for.
Absolutely.
So this linkage between what is happening in your system and the decisions we're making with our votes is actually it should be very clear. So health is, unfortunately, it always looks like it's a doctor. The doctors are supposed to do this.
Absolutely.
But a lot of the decision makers are not doctors, and far from it. And I think the advantage of this show and what this show actually helps with is actually bringing this discussion forward so that yes, some could be doctors, but most aren't.
Absolutely. And I mean, if you were then to even look at the future, right? One of the things we've had this conversation with the producers saying we might want to first bring the state actors to have some of these conversations with them, people in government, people working in different spaces. We might want to bring them, have this conversation. But also, I think, as you're saying, it's an element of being able to say that as a people as well, what are our concerns, right? And what are our concerns specific to us, right? So in many ways, if across the table one day we bring someone from, let's say, County X as always, to come here and say, actually, it's interesting. I was in one of the counties down at the coast just this last month, and one of the women who works as a community health promoter, she talked about how since the facility, she has a kit already, right? And I'll say this is actually now a mini docu-series we want to be doing at the end of every month, where we just have we've gone out to the counties and had a conversation. But back to this community health promoter, where she mentioned she has this kit, she has the digital gadget they were given. And this is also not me taking a stab at the government, not at all. I'm trying to point on where her need was, right? She talked about that's well and good. It has helped, However, she still had to add something in the kit. Then ask her, what is this something? She said she had to add a razor blade and thread. Because women in that area, as they're about to deliver, they end up delivering in the middle of the road because their facility is far. The ones who can deliver at home or have managed to get support deliver at home, right? But she started talking about stories of someone who already perceives complications, had complications. You get on a boda, right? And sometimes the challenge in that area is that, say the boda is even 200, 300, right? They need a day or two to raise the 300 shillings, So I'm pregnant, I'm about to deliver, but 300 shillings is what, less than $1 or right, $2. For her to raise $2, it's going to take her a day or 2 days to raise that. So she started fundraising, right? So when she gets the amount, whatever time she'll get the amount is when she'll call the boda, which is the bike, right? And as part of that distance, she's made her calculations, she'll walk, right? So at a certain point, she's walking. She has to deliver. So she's encountered enough women on the roadside as she's, doing her activities, that she said, I know what I have to do is at least cut the cord, tie it up, right, ensure everything is clean, then she can now continue on her journey. Now you can see, when you hear such a story, and it's the next thing she takes me, we talk to the women, and they start telling you their stories, and you think how beyond even need, sometimes it doesn't make sense, and this is going to be so drastic, to have stocks of anti-venom, say, in an area where you don't have enough snake bites, right? And so one sort of talking about the future, rather, has been those voices, right? They might not make it to studio, but we can go to them, get those voices.
Wow. I mean, this has been a great season 1. Oh, please, what should we expect for season 2? Because after that story, I don't think I can even continue. What do you expect for season 2?
I think more.
Good.
I think it's more. But I think it is more from that lens of getting more community.
Yes.
Bringing more diverse voices from government to private sector.
Good.
We're going to have more conversation on medical conditions themselves.
Good.
Menopause. I have friends who are going through menopause. And not so...
Don't shout age.
I have
mental health. I hope.
Mental health.
Yes.
I mean, there are conversations that we need to have that they might not initially look as if it's a universal health coverage conversation. It might not look like that. But when you have the discussion, you realize, oh, wait a minute, it is a conversation, because what's UHC fundamentally, right? Yeah. It is being able to access quality care when you need it, without financial hardship, right? And those conversations mean if I'm having a mental health breakdown, right? If I am having just the support I need when I'm undergoing cancer care, right? It's the fact that I have not even had, I mean, it's even the conversation we had with KEMSA, right? Family planning.
Yes.
And in many ways, as we look at the future, it's also about who are the partners we can also bring on board, right? To have this conversation. Because again, plenty of people are doing a lot of work.
Yes.
Plenty of people are supporting. I know we victimize pharmaceutical companies, insurance companies, but I've sat with some of them where they are trying to do some programs. And I'm like, come on board, let's have this conversation. Development agencies, I mean, you name it, we'd want to bring them and have that conversation.
Wow. I mean, well, this has been your host. I think that we just have to end it here. This has been your host, Anthony, handing over back to my guests, who will hopefully be hosting season 2 as the future host of the One Health Lens podcast, The Journey to UHC and Other Stories. Please, Diana, now let me let you hand over back. Let me hand it over back to you for now. But I'll be back soon.
I believe
to take over this.
To take over,
yes.
Absolutely.
Okay.
And I'm hoping that you do come back.
Yes.
I'm hoping that we do have more co-hosts, right? Yes. Part of that is let's have some diverse co-hosts as well, right? When Kigondu is too busy attending his meetings as he does.
Doc, I'm taking over your seat. Simon, I'm taking over your seat. Yes.
Thank you so much. Yes. And thank you for joining us on the One Health Lens podcast. We are grateful for being with us for our entire season 1. And I hope you join us on season 2. Thank you. Asante.